Welcome to Ask Dr. Mingle, the series by Mingle Health where we answer your questions about value-based care and value-based payment. I am Dr. Dan Mingle, family physician, founder, and CEO of Mingle Health. It's great to see you again. As you listen in, don't hesitate to ask any additional questions that occur to you. Correct my answers, share your experiences and comments. We are smarter together. The topic for today: the recent release of the proposed rule by the Centers for Medicare and Medicaid Services regarding the physician fee schedule for 2026. I've broken the contents of this presentation into six slide decks, six separate pieces to this presentation to help organize it a little bit better for you and help you focus on just those things that interest you. This first presentation, I'll introduce you to the rulemaking cycle, what's happening, what's going to happen next, and introduce you to places where you can learn more, read more, if you want to dig into it more deeply than I've led you here. The second presentation will be the basics of the quality payment program relating to MIPS and the alternative payment models. Then we'll dig into the proposals regarding MIPS value pathways and its MVPs for 2026. Then we'll dig into the Medicare Shared Savings Program with proposals for 2026. And then the fifth presentation about the proposals for a new ambulatory specialty model in the APM set. And finally, just dig into some of the details of Medicare request for information that came out in this proposed rule. So let's dive right in and get oriented to the rulemaking cycle and the supplemental materials for this particular proposal. Specifically in this section, I'll cover the release of the proposed rule, as I said, the references, resources, talk about submitting comments, and the expected release of the final rule. First, the Federal Register. The link is up here on the top of this slide. All rules, the proposals for rules, the final rules are always published in the Federal Register. You can go to the Federal Register and just search, or you can follow a link there. And in this particular one, the full link at the top takes you to the proposed rule for the physician fee schedule for 2026. This was released, as it always is, in draft format. The draft came out on July 14th, and 2 days later, on July 16th, the final format was published. You can see here on the left a menu that includes PDF. You can access a PDF from there that you can download to your own device and access it when and where you want it, and keep notes on it if you wish. The final rule will be published in the Federal Register as well. The proposed rule will stay there, but through separate links, you'll be able to access the final rules. Next, a lot of analyses, a lot of lists a lot of other data goes into preparing the proposed rule. Medicare keeps a list of these supplemental files on the CMS.gov website. There's a specific set for each proposed rule, and this I don't intend for you to read this, just to recognize the link, how to find it, and where you can go for extra information if you wish. Medicare also publishes several related documents that summarize the major findings in the proposal. Note this one you can get at the CMS.gov site. It's called their newsroom. It's labeled a press release, and this will just review the major elements of the physician payment rule and quality measures and those types of things. In the last few years, Medicare has been in the habit of creating for each proposed rule this proposed rule fact sheet and policy comparison table, where it goes over the changes, what's currently in the rules and how that's proposed to change. This year, find it at this link. Here's another item in the newsroom related to this proposed rule, where Medicare summarizes just those elements that relate to the Medicare Shared Savings Program contained in the rule. Let me draw your attention to the Electronic Code of Federal Regulations, ecfr.gov. See the link up above. All regulations relating to federal programs get codified to the ECFR. So the end of all rulemaking cycles, starting with a proposed rule, which gets comments, which gets finalized. The final rules are written to the Electronic Code of Regulations. I find this to be a more efficient place in general to find rules in which I'm interested. The new rules will sometimes be appended to this, sometimes correct entries in this, or edit some of the lines. And you'll see here we're looking at Title 42, which is Public Health, Chapter 4, which is Centers for Medicare and Medicaid Services, Subchapter 8, the Medicare Program, Part 414, which is Payment for Part B, Medical and Other Health Services. And then subpart 0, which is the merit-based incentive payment system and alternative payment model incentives. And there's you can see the search bar here. I find it a fairly efficient place to find rules in which I'm interested. Two areas in the ECFR of particular interest, if you're following me. At the top is the rules relating to the Quality Payment Program and MIPS, and as an entirely different section, the lower link is to rules regarding the Medicare Shared Savings Program. Now, the whole point of the proposed rule is to solicit comments from the public. So people who have a vested interest in the rules being set give a place to comment on it. For it, against it, proposing adjustments or improvements. I recommend that you make comments. If you particularly like what they proposed, if you don't like what they proposed, regardless, enter a comment. I find the most efficient place to enter comments is right here online in the Federal Register. I'm looking again at the publication of this particular proposed rule, and you'll find there, I've called it out with this red arrow, submit a public comment. Click on that, enter your comment. I choose to enter one comment at a time, so whoever's reviewing them doesn't get lost in a series of comments. So if I have 20 comments, I'll put 20 different entries into this green box. So review the proposals in this proposed rule. Make those comments that raise your interest. Comment early, comment often, as I've heard in many fundraising events. Remember, comments are due by September 12th of 2025. Again, I recommend that you enter them online, although there are other ways you can read about in the first few paragraphs of the proposed rule. Watch for the final rule to be released. It should be in the Federal Register on or around November 1st of 2025. And access the current state of the rules now in the Electronic Code of Federal Regulations, or once the final rule is out, look for the new rules in the Electronic Code of Federal Regulations. It can be a lot more efficient to read it there. The proposed rule has a lot of preamble discussing the history behind the proposal. The final rule contains everything from the proposed rule, plus a full discussion of all the comments and their conclusions. So although it's good to get it fresh fresh off the press, it might be easier to read it when it's in the ECFR. Thanks for joining me today. Again, ask any additional questions that occur to you. Correct my answers if you disagree with anything that I've presented or find me in error. Contribute your comments and experience. We can be smarter together. Submit your comments or questions either to our YouTube channel, our LinkedIn address, or email to hello@minglehealth.com. Thanks. I look forward to seeing you again.